All right. So I've gotten some questions about when I talked about exercise and rebuilding the brain for things like dementia, Alzheimer's, like things like this, post concussion, post traumatic brain injury type of stuff. Um, so I want to preface this by saying that you can't do this until you restore the metabolic function, or however you want to say it, until you restore the chemistry, until you get the nutrient levels back up in the brain, you get the cholesterol levels back up, you get the testosterone levels back up, you get the ATP production brought back up. Until you get those things done, until you get the liver cleaned out and things like that, you can't start this. So this is one of those things that we do about sometimes the third, fourth month in, sometimes second month, depending on where people are. So you can actually create more problems with this than you can solve if you do it too early. And I see a lot of people doing this because their doctors will be like, exercise is good for you. Go exercise. And then the symptoms and problems get worse. And the reason for that is that we go back to that, what we call the point of diminishing returns. If the body can't regenerate, rebuild, and heal from it, you're going to have problems from it. All right. So that's the thing. So if you have a family member with dementia, do not put them on this program. Send them to us and we'll go through it. But I want to kind of go through it anyway, because if your body is healthy, then these are great things to keep in mind from the exercises that we're looking to do. So one of the things that we always want to start with when we have somebody with neurodevelopmental issues, neurocognitive issues, things like that, is we want to kind of go back to the basics. And your brain is literally built off of motion. So the information that comes into your brain from the outside, what you see, vestibular, so your balance, and then all the motion from all your joints, build the brain. This is why chiropractic is so critical to neurodevelopment. This is why it's so important for maintenance function and for general overall health, is because of what it does metabolically to the brain and all the information that comes in and how it rebuilds neuroplasticity and all that fun jazz. So you're going to be getting adjusted when we do this as well. But we're going to start off with things called cross crawl exercises. So you literally have people get on the floor and crawl around on their hands and knees. This helps to kind of produce function. When you're doing that, you're making sure where the back is, where the head is, like they're looking up. So you get all that activation to the, what we call the posterior column, or the posterior spine, the back of the neck. So they're looking up and their eyes are up. And so that as you're bringing your eyes up, it changes the function of the information that goes into your brain from your eyes. And we'll have them crawl around like this, quite a bit. One of the things that we will do that's really, really super beneficial is, again, when they're ready for it, we'll have them in shorts. So shorts, no socks, no shoes. And we'll have them crawl around outside in the sun with as little clothing as they can be in, so we can get the most sun exposure to them. So you're also getting grounding function, because the frequency energetic function of the body is really important for that. And so you're getting grounding function and you're getting it in short bursts. One of the things we always want to do is look at changing the energetic frequency function of all of these people who have any type of neurocognitive issue. We want to start resetting in cholesterol functional damage. We want to start resetting that function and that charge. So we have them crawl around on the outside first. Don't put these people directly on grounding sheets. It can be too much. Like they get detox reactions and things like that. So you got to kind of build them up. So the crawl around outside on the earth thing is fantastic. It really kind of helps a giant amount of different things. And you'll have them do it for about 5-10 minutes. And so you kind of build up to this. Maybe you start doing them a couple times a day. Then what you have them start doing is you have them start doing, core work. You have them start so when I say core work, remember that's pelvis and everything that attaches to it. So we can start doing body weight squats. We can start, walking up small stairs. The body weight squats are usually first, because walking up elevation, whether it's a 6-inch stair or whatnot, is going to have vestibular play in it as well. So balance, coordination function as well. And so that's going to be a little bit step up. So you want to be able to do those up downs, the squats. So you get a low chair that's at parallels where we start. And we get used to standing up and sitting down, and then we drop that a little bit lower. I try to get about 4 inches lower, so you can get, instead of being parallel, your angle of your knee and your butt is kind of there. And so we have them stand up and down from that. Obviously with things they can hold on to and stuff like that. And then we have them start walking up and down stairs. And then we start having them stand on one foot, and there's all sorts of ways they can, there's a wall right here. They've got a handle right here. There's all sorts of things that they can stop that. And then once they kind of get used to standing on one foot, then you destabilize that surface with foam. And so they're standing on it there. And then we can slowly work up to my favorite exercise, which is single leg squats or single leg step ups. So you're basically just increasing the size of the stair they're stepping up on. And they get giant amounts of what we call afferent information, or information from the joints and everything to the brain, from the hip, from the knee, from the ankle, from the toes, from the lower spine, the SI joint. So all this information, giant amount of information, is just flowing up to the brain and causing brain function to increase. I'm trying to stay as low level as I can on this. I'm not, okay. So what actually happens is all that information hits the cerebellum forces the frontal lobe suppresses the temporal lobe. And so we actually get suppression of amygdala function. So you're going to start seeing reductions in fear, hate, anger, terror. And so we get cognitive, emotional, functional control as well from these. This is one of the reasons why when you go, if you're all pissed off and you go take a walk or you go exercise, you're not a lot less pissed when you get done exercising, because that's what happens. That's the function through the brain. But so those are one of the big things that we'll do for that. And as we start building these people back up, you'll start to see lots and lots of things return. But remember, so these people are already going to be where their hormonal function is going to be returned. So they're going to be, their testosterone levels are going to be where they're supposed to be. Their D3 levels are going to be where they're supposed to be. And all these people's diets have been radically altered. So we're going to have a much higher fat content, much higher protein content, much, much lower, if not completely negated or completely taken away, sugar function. So what ends up happening is that we get a lot more ATP to the brain. We get a lot more oxygenation to the brain. We get a lot more healing function to the brain. A lot of these people are going to be on BP 157 and TB 500. They're going to be on Smorelin and Ipamorelin. And what that mix does is increases the actual growth hormone receptor sites. So we get a lot more punch. We get a lot more effect out of our growth hormone and our testosterone. So not only are we rebuilding the brain, but we're rebuilding the body at a ridiculous rate. And so what you end up seeing is that these people start to get, they regain their balance and coordination. They start regaining, joint function. They start regaining, all sorts of conditional function, cognitive function, emotional control. All these things come back really, really quickly because we're giving them everything the body possibly needs to regenerate and heal this. So, it's not just, go put grandpa on these exercises and he'll get better, or put yourself on these exercises and you'll get better. Unfortunately, the body and the brain are substantially more complex than that. But as long as you give them the nutrients they need, they will regenerate and heal. And one of the other things about that diet is it radically reduces the glucose. So the sugar toxicity that the brain has, and the hormonal toxicity, specifically being insulin toxicity the brain has, the diet and the exercise both radically help reduce that. Because any excess sugar that's in your body, your muscles will burn up real quickly as you're starting to do these exercises, specifically because a lot of these have lower extremity involvement, so legs and butt and that type of thing. And so as you're using those larger muscle groups, it sucks that stuff out of the system a lot faster. So these things are fantastic. These exercises are fantastic for these people once they get there. But it's one of those things that, if you're working on dementia and you've gotten you've lucked out and you got somebody who understands metabolic function and dietary function, and they've started to put you into a path of, a lower glycemic, whether it's keto or not, I would highly recommend you get with someone who knows how to put people on keto and knows how, because not everybody can work through keto. Like that's one of those things that, we don't talk about, but biochemically, sometimes people can't use it. And so, like I talked about my patient who was on carnivore and didn't produce enough sugar, and so she couldn't do it. You got to work with somebody who knows how to do that. But that keto style diet, which we know, like we've, all the stuff on epilepsy has shown that, at the keto diet done properly is wildly beneficial to changing metabolic health and functional health and biochemical health, however you want to say it, of the brain. Like you'll take people who have massive amounts of seizures, you fix their oxygenation issues, and you fix you reset their diet to a higher fat diet, much, much, much lower on the glucose function. And then bang, like seizures will stop. Like not every single time and every single person, but like in a lot of people. Like you bring me the average epileptic, and with dietary changes, and we watch their sleep function and we detox them a little bit, give the body back the methylated B vitamins and things it requires, and you'll see epilepsy just go through the floor. It's really amazing. And this information has been out for 200 years, at least 100 years. And this is one of those things that, the medical system suppresses, because if you can fix people's dementia, if you can fix their, diabetes, if you can fix if you can fix a lot of their problems without pills and just the diet, well, then that takes money out of the system. So Western medicine will never tell you about it. We could probably fix, I would say, if everybody did it right, 70% of all chronic disease would go away in the United States, just by fixing diet. And that would 100% bankrupt all the pharmaceutical companies, 100%. Because if no more statin drugs, no more depression drugs, no more, no more, lots of chronic pain would go away. All your diabetes function would go away. A lot of your heart attacks and strokes would go away. A lot of your cancer would go away. And that's why it's not being taught. And so people are like, how come I'm not hearing this from anybody else? That's 100% the reason. Hopefully with RFK coming in, we'll be able to get some of this information out. But what we know for a fact is that the closer we get the body metabolically and whatnot back to original design, which means getting the chemicals that the body requires in and getting the chemicals the body wants out, whether we either never put those chemicals in the body, those toxins in the body, or we're able to shuttle out our metabolic waste faster, we will get healthier. Like it's 100% of the time we've seen this every single time. And so this has been a proven functional thing. So that's the goal, like to get these people back. And so hopefully with RFK, we'll get some of this stuff done. But it's gonna be a slog. It's gonna be a fight. It's gonna be a battle. But yeah, so that's the exercise piece. But like I said, that piece and the chiropractic piece is 100% critical to this, because nothing will increase joint mechanoreception function more than chiropractic. There's nothing that's been studied that does more function for increasing information from the body to the brain than chiropractic, because chiropractic's whole sole job is to remove that information, that inhibition or that block of information to and from the brain. It's its whole stated purpose. So getting adjusted usually twice a week is what a lot of these guys need. Sometimes it's 3, but getting everybody adjusted and then exercising is really, really awesome. Yeah. So Jason, a lot of people are starting like, oh, I'm starting to hear that dementia and Alzheimer's is type 3 diabetes. Yeah, it is. Like you could easily make that argument. Because one, we have the things that create diabetes are glucose metabolism problems, which you 100% have in Alzheimer's and dementia, and 2, insulin resistance problems, which you 100% have in dementia. So like what you're looking at is, again, this is more information more people want to know, but this is what it is. The receptor that moves sugar from the blood to the brain area, what we call the cerebral spinal fluid, is called a GLUT1 receptor. That GLUT1 receptor is wildly dependent upon insulin to turn it on and off, tell it what to do. So if you have high fasting insulin, what's going to end up happening is that your blood, which is supposed to be between 80 and 100 blood sugar, is going to start dripping sugar into your cerebral spinal fluid space around your brain. That's supposed to be 55 to 60. So 100% type 2 diabetes is going to lead to sugar and glucose metabolism problems and insulin problems in the brain. So 100%, you could call it type 3 diabetes. I wouldn't. And the reason I wouldn't call it type 3 diabetes is where I actually have a little bit of issue with this, is because people go, well, I have type 2 diabetes, therefore my brain is safe. That's 100% wrong. If there's a fire coming towards your house, if you're like, well, just because the fire hasn't gotten here, I don't have to worry about it. Yeah, you do. So it's one of those things where, like, as soon as you recognize that you've got type 2 diabetes, you have to understand your heart, your blood vessels, and your brain are all under attack. And as soon as you recognize that and you start adjusting it and fixing your type 2 diabetes, everything in your whole body gets better. And there's some peptide work, there's some hormone work, there's a giant amount of dietary work, there's some sleep stuff. Sleep is big for this as well. And I'll touch on that real quick. I got about a minute left. One of the things that happens when you're asleep is that your body, if you have sleep apnea specifically, and this is one of the things we go through intensely, is if you have any sleep apnea, what ends up happening is that when you startle yourself awake, the reason that you startle awake and in the process of startling you awake, you release adrenaline and cortisol. Those two things will spike your insulin every single time, and they'll also dump a bunch of sugar into the bloodstream because you're in fight flight. And so what ends up happening is that you watch these people who have sleep apnea issues, and they've got horrible other issues in their body. They've got damage to the brain function. They've got, electrolyte function problems. They've got, insulin response functions. And a lot of these people have insulin resistance. These people can't lose weight because all through the night you're dumping adrenaline, which wakes you up, and you're dumping sugar, which, spikes your insulin. And then, you're holding that stuff there all night long. And so that's one of those big things. And so we've got to start working on getting people back to sleep. You got to look at oxygenation, centralized sleep apnea, not just obstructive sleep apnea, which is a big problem people get into. I'll get into that tomorrow. But that's basically where it is. So there's like when we treat, the reason I like to treat dementia is because it requires all of the pieces to be put back together properly. But this is a big deal. Hopefully people will start to recognize it and start treating it this way, because the drugs they're giving people are just making it worse. So, all right, if you guys have any questions, just have questions at chalmerswellness.com, or drop them in the comments or hit me in the DMs. Have a nice day. Thanks for your time.